Hi, my name is Rialon Berry. Thank you for joining us for our webinar this afternoon. Just a friendly reminder that you could submit questions anytime by typing them into the questions pane of the control panel. That's on the right side of your screen. We will answer questions at the end of our presentation. So without further ado, the talk of today's webinar is More Than a Pesky Habit, How Parents Can Help Their Child Manage Trichotillomania and Other Body-Focused Repetitive Behaviors. So what we'll be talking today about essentially is to help parents get educated and to learn some tools about how to help their child manage these sometimes complex conditions. And my intent is to have everybody leave with a little bit of information as to how to respond to their child or to point them in a direction of potentially getting help for these conditions if needed. So first, we consider habits and body-focused repetitive behaviors to be frequent repetitive actions that typically occur or look like nail biting, nail picking, or hair pulling that are usually directed toward one's own body and often focus on removing or grooming parts of the body. Within our diagnostic classification system, we have two diagnoses for these conditions, the first being trichotillomania or hair pulling disorder, as well as excoriation or skin picking disorder. Trichotillomania itself is going to be the primary focus of this treatment, but again, some of the elements that I'm referring to can be considered amongst body-focused repetitive behaviors in general. Trichotillomania itself refers to the frequent and recurring pulling out of one's hair, which can result for many people in noticeable hair loss. Most individuals report feeling a sense of tension or what we consider to be a premonitory urge immediately before pulling out the hair. And following the hair pull, there is this sense of pleasure or gratification or relief that individuals note after they pull their hair. This condition is not better accounted for by other medical conditions, and it's considered within our diagnostic classification system because it can cause clinically significant distress and impairment for many individuals. So what we know about trichotillomania is that its primary onset is usually within puberty. In childhood, we typically see that boys and girls experience the disorder quite equally. However, it tends to be more frequent in females in adulthood. For some, this can be precipitated by stressful events or some type of something that causes anxiety, but that's not always the case. And we do know that this condition can be chronic, meaning it can occur in bits and spurts or wax and wane over the course of one's life. Interestingly, there are some individuals who report significant periods of time in which they haven't engaged in hair pulling whatsoever. And there can be some pretty significant effects associated with this disorder as well, such as low self-esteem, low life satisfaction. And amongst a little bit of research that we have about trichotillomania, we don't have a sense of if there's one cause behind this. Most research points to there being both a genetic and environmental condition that can contribute to the development or the onset of the disorder. There are two types of hair pulling that we like to focus on within the clinical literature and within the treatment, and they're not mutually exclusive. So most individuals, about 85%, will report that they engage in two types of pulling. The first type of pulling is considered focused pulling, and that essentially has this emotion regulation function to it, meaning it really provides a sense of relief to the individual after they engage in the behavior. And this behavior is maintained because it does serve to provide a relief or a reduction in that anxiety. Many individuals that I work with report during this focused period of time that they actually want to, or they actually feel like they quote-unquote deserve to engage in this behavior because they are undergoing so much stress. The second type of pulling is what many parents report of their kids seeming like they're in a trance, or they're in some sort of zone where nothing can get to them. And this is referred to as an automatic pull. Oftentimes, this is done by individuals who are engaging in what we consider to be mindless activities or activities that don't require a lot of engagement, such as watching television or reading or being alone. So many individuals following a hair pull will actually play with the hair within their fingers. Some will put it to their lips, others may put it between their teeth. There are individuals who do nothing with the hair afterward and rather just let it fall, or some may even put it in the trash. But what can happen with trichotillomania over time if this is done excessively is it can result in an absence of hair from certain parts of the head or bald spots on the eyebrows or just an overall thinning of hair. And for this reason, that's what many individuals will say leads them to develop that sense of low self-esteem, because with this noticeable hair thinning or loss of hair, they fear being judged by their peers or being judged by others in the environment who notice that there are these spots missing from their hair. For some individuals, on an extreme note, where they may engage in actually eating of the hair, some may develop what's called a bezoar in the stomach, and that can, in a worst case scenario, involve surgery or an operation because of things like it causing vomiting and nausea and things like that with the growth of the hair in the stomach, or the accumulation of hair, of hair within the stomach. So one of the things I really like to encourage parents to think about too, it's common that I have parents really concerned about that these behaviors reflect a type of self-harm because they are directed towards the body. And I really want to emphasize from the get-go that these behaviors aren't intentional. They're not reflective of a personality trait or something that the child can just sort of stop so abruptly or just snap out of. These are things rather that are, I say that the habit is the habit chose the child for those reasons, that it is both a genetic and an environmental condition. But there are, big effects that come from this condition, such as the development of embarrassment around the behavior, the sense of shame that comes from feeling like they aren't able to stop. And because of these intense emotions that are experienced, as well as the anxiety might come with it, individuals may have a difficult time seeking help for that. And so it's really important for parents to have some information and know that their child might be feeling this way ahead of time, and know potentially a different way of approaching their child to get help. So a common question that I experience from parents is, why can't my child just stop pulling? And again, that really reflects that the child is motivated to pull or wants to pull. And even though I said that there is a sense of pleasure or relief that comes from the behavior, that doesn't necessarily mean that a child is purposefully and intentionally engaging in this behavior. Believe me, if your child could stop this behavior, they absolutely would. But we have to know that there's some other behavioral and biological process inherent here that's actually perpetuating the pull cycle. And so with that being said, many parents who just tell their child to, quote unquote, just stop, or even maybe try to reward or bribe their kids to avoid pulling, is really going to fall short, because it's not so simple. And again, I think what I'm emphasizing here is that this isn't the type of habit such like you're chewing on your pencil tip or cracking your knuckles. This is a habit that has a biological, physiological, and behavioral reinforcement system embedded in it, which makes it all the more challenging to work against. Okay. One of the great things that we know is that there are good treatments for trichotillomania and body-focused repetitive behaviors. So what I'm going to be talking about now are just some of the simple components involved in what's considered to be the most efficacious treatment for body-focused repetitive behaviors in trick, and that is cognitive behavioral therapy with habit reversal training. So I've shortened the components of HRT, or habit reversal training, here, wanting to really emphasize some of the most important. So just in a simplified version, HRT involves awareness training, competing response training, an optional segment for relaxation training, and social support. So awareness training is one of the most important components of the HRT process, because it really involves helping an individual understand what the sensations are that they experienced before engaging in a pull, and getting them to feel more confident in understanding when their premonitory urge or that sense of tension comes before they engage in a pull. Part of the awareness training process also involves looking at the specific situations that one individual may be more likely to pull than others. For example, time in front of the computer, time in front of the TV, or other stressful situations like doing homework that could potentially elicit more frequent pulling. And here the individual, even though it's uncomfortable, learns how to describe their urge to pull, what it feels like, and then that leads us into really being able to help them kind of tap or manage or kind of constrain that urge, and so it's to better develop ways to work through it. So that's when we get to this, what's called stimulus monitoring. So stimulus monitoring is a process by which we have already identified the areas with which a pull may be more likely to occur, and then we being the therapist, the parent, and the child, work to find ways to help create an environment that's going to lead to potentially less hair pulling. For example, making sure that a child has Band-Aids on while they're watching TV, sometimes putting gloves on while they're watching TV, or just creating more of a conversation during TV watching to sort of, negate the child's engagement in that behavior. The third phase of the HRT process is what's called competing response training. And this really involves teaching a child to substitute a response that is considered incompatible with the unwanted behavior, and in this case, the unwanted behavior being hair pulling. So essentially, the child is taught to engage in another type of movement or another type of activity each time they have become aware of that premonitory urge or that sensation to engage in the hair pulling. And that behavior, or the sort of the opposite behavior, the competing response, is the individual takes action on that each time they are also in a situation where the hair pulling might occur. So what I mean by that is not only is the individual using a competing response when they actually feel the urge to pull, or maybe after they have already pulled, they engage in that competing response when they get into the situation where they are likely to pull. So one example might be if a child knows that when they always pull when they're watching, kind of like a mindless show in the evening after homework, they have their competing response tools ready and immediately engage in that behavior, that opposite action before or right when they sit down, or even before they sit down. So some of the competing responses that we like to use are almost always inconspicuous, meaning they're not going to draw a lot of attention from the environment. Again, because we want the individual to feel more comfortable using them in such places where other people might be present, such as in school. Okay. Because body-focused repetitive behaviors in trichotillomania often occur comorbidly with other conditions such as anxiety and depression, it can often be helpful to teach a bit of relaxation training or calm body strategies to help relieve some of the physical tension that can go along with anxiety. Parents can be instrumental in helping encourage their children to participate in relaxation training daily, either by rewarding them or just gently prompting them to do so. So some ideas or some examples of common relaxation strategies include deep breathing or belly breathing, utilizing visual imagery in the mind, and as well as progressive muscle relaxation, which involves the contraction and the release of several different muscle groups at respective times. Okay. A core area where parents are involved in the habit reversal training process is in providing social support. So for most individuals or most youth that engage in the HRT process, we do like to bring in family members who can be supportive and provide a little bit of extra motivation and sometimes reinforcement for utilizing these strategies. And if you remember from a few slides back, I mentioned the importance of parents being mindful of not just telling their children to just stop pulling or trying not to call attention to their child when they're pulling, because what that does for many youth is that it brings up these negative emotions of shame and embarrassment, and the child knows that it really is so hard to stop. So we want to encourage parents to really be there to provide feedback to the child for utilizing the competing responses, for remembering to grab the gloves, the headband, or the Band-Aids, because those really make the child feel like, okay, you're noticing the good things that I do, not just calling me out for the negative things or the things that I know it's just really hard for my body to stop. So right off the bat at the start of treatment, I make sure that parents aren't sort of rewarding their child with a new iPhone for going 6 weeks without pulling, but rather taking it on a day-by-day basis and providing verbal rewards, reinforcement and validation, as well as sometimes, if appropriate, tangible rewards for practicing the skills, right, that are going to help manage the hair pull over time. Okay, so essentially just to review the model of habit reversal training that we're trying to do, we know that there's an environmental trigger that the individual is familiar with that leads to this premonitory urge or that physiological sensation in the body. So with awareness training, we're trying to get the individual to know when that comes up, what that feels like, so that they'll be more primed to utilize that competing response or that opposite action, that incompatible action. And then through that, we see that the feeling of tension or that need of release tends to subside, even though it can be quite difficult at first, and that sort of disrupts the cycle of the pull. And in doing that for, over time, over and over, the body essentially can learn, oh, I don't necessarily need to follow through with that urge. I can find other ways to work through that tension in my body, and that it eventually subsides over time. Okay. An important part of the treatment process can be working with schools. Now, some youth report that they are able to sort of suppress or manage their urge at school such that they don't engage in it, and that can be quite common. However, there are times where individuals report during exams or other stressful periods, or when they're bored during a lecture, that they may engage in the behavior. So for that reason, it can be helpful to, if your child is willing, to have a conversation with the teacher or with the school in general. And so some of the type of accommodations that we often advocate for use in schools are access to a small, inconspicuous fidget toy that the child can use when they're bored or when they're feeling that urge, and so to help offset the hair pulling behavior. Because these behaviors can really take a lot of time and be interfering, some youth may need extra time on projects or on exams, and so we do ask for extended time on these things, as well as a separate testing location when needed. And if it's possible, or if a child is willing, a teacher can be instrumental in coming up with a coping plan or a way that the child can manage the anxiety related to the pulling or manage the pull itself. But again, this should be taken on an individual basis, and if the child is willing to share this information with their educator, because it can be something that they may not want to be drawing attention to in class. So I always encourage parents, or I ask the child up front whether or not they would like us to take this step. Okay, so for some of the key points, this is sort of the meat of the talk. How can parents help? And I think just participating in this webinar is really one of the first steps, because body-focused repetitive behaviors and trichotillomania aren't necessarily things that a lot of even medical providers are aware of. One of my slides showed that there's less than 1% of the population engaging in this behavior. So it's important that parents really understand and go to the right sources to help their child work through these behaviors. A great site that I always refer parents to is bodyfocusedrepetitivebehaviors.org or BFRB.org. It used to be called trick.org, but now they really changed the name to encompass all the body-focused repetitive behaviors, including nail biting and skin picking and whatnot. As I had mentioned, it can be hard for children to work through the types of feelings, the anxiety, the embarrassment, and shame that can come along with these behaviors. So don't be surprised if they're initially rejecting of help at first. Be validating of whether or not they want to, but if you start to notice that your child is experiencing some distress, maybe because of the secondary anxiety or depression that comes along with the hair pulling, it may be necessary for you as a parent to say something like, I'm concerned about your happiness, I'm concerned about your well-being, and I know that there's a good treatment out there that can help you. Please let me bring you to someone who can help us work through this condition. Okay. And again, going back to some of the information I presented earlier, we must be aware that this habit isn't a result of a personality trait. This habit chose your child because of those genetic and environmental factors. And for that reason, we don't want to view it as something that they're just doing intentionally, or that it's inherent to them as a character flaw. If you can, try to be supportive, even though I think a lot of parents may respond with certain things because they're scared. They're afraid of their child feeling more embarrassed, and they want that to stop. But understanding where this comes from and how difficult it is can really be so relieving to the child as a first step. And if your child does want to talk about it, if they do say to you, hey, I just can't stop, well, let's take the time to listen and believe them, and don't correct them that, no, you can, you're just not motivated. that could actually make a child go back and engage in the behavior even more. And again, seeing this as something that your child is going through, that a habit that chose them, can hopefully, relieve any efforts to punish your child for engaging in the pulling because you so badly want them to stop. Okay. And finally, just some take-home points from this talk are just to remember how hard it is for the child to stop picking from an area, and that instead we want to try to reframe the goal as being able to corral or to manage this urge that's coming from the brain, and learning other ways through competing response training to kind of, allow that urge to naturally pass through the body. One of the sort of analogies that I like to use, or the metaphors rather, is to think about, your child working against his hair pulling as if they're a tennis player trying to battle against Serena Williams. I don't know many people that can really stand up against a serve from Serena Williams, but I like to sort of get parents to be in that frame of mind to understand how challenging this is in their body and the level of distress that they can feel to try to even utilize a competing response. The best thing that you can do is actually respect, and many times, the space of your child to engage in these behaviors, and really try to provide support if they want it, or provide verbal reinforcement if they ask for it, for using the positive behavioral skills and whatnot. Otherwise, you can just kind of engage them in conversations about other things, and get them to talk about normal life, and not just about the hair pulling. That's often a request that I get from a lot of my youth, is that they wish that their parents would just talk about something else rather than not pulling. And again, just in sort of going on to the next point, we don't have a lot of great information about the true source of body-focused repetitive behaviors, although we do have some indication that it is a result of, there is a genetic linkage to it, and some environmental factors can play a role. We also do know that we have good treatment through the cognitive behavioral therapy with habit reversal training to help youth manage these urges, and many have been able to not engage in pulling for quite some time. Although, importantly, we know that this is a chronic condition that can wax and wane over time, so some accommodations and some application of these tools may be necessary for the long run. Okay? And that ends the webinar now, so I'm open to any questions that folks may have about either the body-focused repetitive behaviors or the treatment. Okay, so I'm going to take our first question. Okay, so our first question is, how should I approach my child if I notice they start hair pulling? And so this is always a very complicated thing, again, because if we catch a child in the moment when they're pulling and then we ask them, why are you doing that? That for many youth can feel invalidating, meaning they'll perceive it as a negative reaction to something that they're doing, or that they're doing something wrong. So I would actually approach the child in a different situation, in a calm or maybe even a lighthearted moment, where you say, and especially if you've noticed the behavior occurring a lot, I might say something like, hey, the other day when you were doing your math homework, I saw that you had your hand in your hair, that you may have actually pulled out a couple of hairs. What's going on? Is that something that happens? Is that something that's been bothering you? And if they immediately shut you down, which if you have a teenager, they sometimes might, let's let it go. And then again, when you start to notice that maybe it's causing that secondary anxiety or that potentially depression, then we might want to bring up a more firm amount of concern and say, I've noticed that the hair pulling's been happening a lot more and maybe causing you some distress. I'm worried about that, and I want to get you some help. Can we work together to find somebody that can help you gain some tools in understanding this behavior or working through it? So again, it's not always easy. We can sometimes expect a little bit of shutting out, but let's just take that shutting out and approach again another time. I always like to say, I always like to give youth invitations to talk. But then when it comes down to, okay, you're needing a little bit of help, I'm your parent, I know, then I've become a little bit more firm about doing something about it. But that's a slippery slope to walk, right? Are comorbidities common with this disorder? Yes. Some of the most common conditions that we see going along with hair pulling or body-focused repetitive behaviors are anxiety and depression. And oftentimes it can be, but not always, related to those types of emotions that tend to come, the embarrassment, shame, and guilt that come from engaging in the behavior and folks feeling like that is too hard to stop. The third question is, how do I convince my child that treatment would be helpful? Sometimes convincing is easier said than done because, again, many youth generally want to stop, and they are motivated to stop, and many feel that, no, I absolutely don't need another person to help me do this. I can do it on my own. And remember the Serena Williams metaphor, right? It's an incredibly challenging thing to work against. So convincing your child sometimes can be just sort of saying, hey, making sure that you have a provider, and the BFRB.org often has a list of providers in certain areas that do the habit reversal training, so I might start there. But making sure you identify somebody first, making sure you have done some research to say, hey, I know a little bit about what you may be going through. Again, this seems to be causing you some distress. Let me help you. Just like you would help them if they had a different medical condition, you wouldn't wait. And so if you feel that they're at the point where they need it, by all means, assert that. You'd just like them to go give a psychologist like myself a try to see if they might have some tools that would help them feel some relief. The fourth question is, what if the child is pulling hair out at night as they fall asleep, or even before they fall asleep? Now, the hair pulling usually does not happen once somebody is actually actively asleep. However, before kids fall asleep, when they're in their bed, when the mind is sort of getting to the point of being quiet, is a common area where folks may fall asleep. So going back to the slide about stimulus monitoring and competing response training, as part of the treatment, we would actually work with the child to identify every single area, every single part of the house or part of the school where hair pulling might happen, and then we would try to modify the environment or modify something about their behavior to reduce the likelihood that a pull would occur. So at nighttime, I would actually recommend that my kids have something on their nightstand or by their lamp. Like sometimes it's even as simple as a sticky note or a note card that says, hey, did you get your koosh ball, or did you grab your Band-Aids? And sometimes that's enough to help them remember to put something on their fingertips. Sometimes kids can be forgetful and they just don't remember to look at those sticky notes, or they just don't remember to use it. So as part of the treatment, as part of the collaborative treatment process, I do work with the kiddo to say, hey, that seems to be a tricky area where you may not be remembering your Band-Aids. Is it okay if mom gives you just a subtle reminder, using words of the child's choice, to have you engage in, or to have you remember to use your competing response? And then they get rewarded for then utilizing that behavior. Okay, do we have enough time for one more? The fifth question is, what kind of medical professional can I approach to help me with hair pulling? And so I would say that psychologists or other therapists, sometimes psychiatrists who are knowledgeable about body-focused repetitive behaviors and trained in the cognitive behavioral therapy with habit reversal training are the best people to go to. Now, I recognize that sometimes it can be hard to find those individuals. I might recommend approaching a pediatrician first for assistance in being able to navigate this tricky process of finding a therapist or a psychologist who can do this treatment. It can be difficult, but first place I recommend going to is bodyfocusedrepetitivebehaviors.org. If not there, the abct.org, that's A, B as in boy, C as in cat, T as in tom.org, or A, D as in dog, AA.org, often can have different providers listed who specialize in the treatment of body-focused repetitive behaviors. Okay, I'll take one more. Question 6, is there a book a child can read about this topic? The answer is yes. For younger children, there's a book by Ruth Gollum called My Hair Pulling Habit and Me. So again, that's My Hair Pulling Habit and Me is a really nice resource for helping kids understand where this behavior comes from, and it actually has different exercises to help the child work through some of these tools on their own or with a parent. Okay. Okay. So I just want to remind folks that we do have an upcoming webinar with one of my esteemed colleagues, Rialon Berry, and he'll be talking about medications demystify, the ins and outs when considering medication for your child. So we hope that everybody can tune in to hear Dr. Berry speak about that. And thank you all for your time and for your questions, and best of luck.